Time now for a very important parental alert. Get your kids to the dentist, darn it.
For the month of November, Hawaii Family Dental and Kidshine are teaming up to provide pre-checkups for children. All parents know the drill. This time of year can be tough. The Halloween candy, cavities. So we have some tips you need to know. We're visiting our friends with Hawaii Family Dental and Kidshine from across the island to get some of their tips to keep your kids' teeth healthy. I'm here with Dr. Amanda from Kauai to talk about this. Nice to see you.
Thanks for having us.
Now, this is a particular issue because we have a big problem with children and cavities. Tell me about that and some of the challenges.
Absolutely. So one of the challenges that I think that we have here in Hawaii is education in general. I think that so many kids have had cavities for so long that parents honestly have forgotten or don't understand that cavities are entirely preventable. So I'd say the first challenge is just education in general and how important that is. The earlier that we can get the education and the messaging to those parents, the better. And it also gives the child a chance to get used to the dental office, to the noise, to the sounds, to the smells. They can watch the older kids and how cooperative the older kids are being. So that's really the best way to set your child up for success for the long run, is to get them to the dentist early.
Now, I know you have to educate the parents, too. We know this, too. Any advice, tips you would give them for establishing a healthy, positive routine early?
We love to recommend the concept of brush, book, bed. So if you can get into the habit that every night we're gonna brush your children's teeth, we're gonna floss their teeth, and that's how they earn their bedtime story, and then they go right to bed. So if the child is in the habit and parent is in that routine, they're less likely to put up a fight about it, and you're less likely to go, oh, maybe we'll do it next time. And the other recommendation that I have with Halloween coming up is not all candies are created equal. The sticky gummy candies, the Sour Patch Kids, the Skittles, the gummy bears can sit in between your children's teeth. So let them indulge, have your fun Halloween, but that night it's extra important to make sure that you brush and you floss and that you throw away the extra Halloween candy.
Great advice, thank you. Okay, we found out about that. Now we want to find out about cleaning and some of those visits. I'm here with Dr. Hanks from Maui, and I want to ask you what tips you have for parents who might be bringing their kids in for their first dental visit.
One of the things we tell parents is try to have them in by age 1, and part of the reason is because when they come, we want their kids to be confident at an early age, knowing, oh, I've been here before. As they come every 6 months, they're going to get more and more comfortable with staff, they're going to get more and more comfortable with me, and they're going to realize, oh, this is what I do with my parents when I come to the office. What they can expect is a lot of parents ask me, am I able to come back with the child? Absolutely. I want parents back there because I want it to be a partnership between all of us.
As far as the actual teeth and development goes, a lot of people might wonder, you have the baby teeth anyways, but you got to take care of them. They're going to fall out, we know, but you have to take steps to take care of them.
Yeah, I get that question a lot. People say, well, there's all these cavities, but why don't we just wait until they fall out? Are they going to cause any issues? Baby teeth are very important to the development of a child. Oftentimes, one of the biggest issues is between the back teeth, where I wish we could get everybody to floss, but everybody doesn't. We oftentimes have cavities growing that grow pretty quickly because children's enamel is a little thinner. It's a little less forgiving than an adult, so you can't get away with neglecting home care. And because of that, cavities start to grow. And as they grow, they get closer and closer to the nerve of the tooth, which can cause an abscess, and which can lead to infection, discomfort, pain, and even facial swelling. So it becomes a little bit more urgent. Another reason is if you were just to say, well, let's pull out the baby teeth, why don't we just take them out? They're space maintainers. They're the best space maintainers we have. And once you lose them, it's like losing a parking spot for that adult tooth. And all of a sudden, they start to tip in, and they can't come in like that. And so when they can't come in, you got a lot of orthodontic issues as they grow. So if you want to save money in the long run, take care of the baby teeth.
A lot of parents, their ears just perked up when you talked about the money saving. Dr. Hanks, thank you. We're also going to talk about a doctor from the Hawaii Family Dental Oahu team. I'm here with Dr. Dave to find out more about the difference between pediatric dentists and general dentists. Why is it so important for someone to get a pediatric when focused on talking about children?
Sure. So the main difference between a pediatric dentist and a general dentist is that they'll both go to school for 4 years for their general dentistry, and after they'll go 2 more years, a pediatric dentist will go 2 more years for specialized training. So that training will mostly be geared towards behavior management, sedation dentistry, whether that's in a hospital or in office. Also, they'll be doing a lot of things with growth and development. As teeth are growing, we want to make sure we're saving spaces. And the other is working with the primary dentition, so the kids' teeth.
And we know that it's important to both Kidshine and Hawaii Family Dental to get kids in early, making sure that they're doing things properly. So tell me about the mission and what's planned throughout the month of November.
So what we're planning to do is, Hawaii has the highest rate of cavities in the nation. 7 out of 10 kids that are in the 3rd grade have active cavities. And we want to take that, we want to get out of last place, and we want to bring more awareness to the community. So we're offering 500 free dental appointments in the month of November among the 9 centers. So 2 of our centers in Kapolei and Pro City, and all the other centers in Hawaii Family, we're going to offer those free services for the kids.
That's fantastic. So you're going to have to book it. Thank you so much for having us out. It's been great getting all the advice here when dealing with your kids' teeth. We'll post all the information on KHON2.com. Great to get a chance to talk to all the pediatric dentists who are visiting from Kauai, Maui, and locally too, but free checkups throughout the month of October. So go ahead and call. Make sure you take advantage of that because you definitely want to get the kids used to good habits early.
Yeah, this is a great segment, especially with Halloween just a couple days away, because everybody's going to have rotten mouth come Friday.
And the parents too, for all the quality control we have to do.
Yeah, for all the parents that are taking the kids' candy, of course. Yeah, all right.